The effect of poverty over the lifespan. Please forgive generalizations made for simplicity. According to Healthy People 220, an initiative promoted by the Office of Disease Prevention and Health Promotion, the social determinants of health are conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. In this video, we'll address the cumulative effects of economic disparities and will compare the lives of two fictional characters living in the United States. Person A was born into poverty, and Person B was born into the middle class.
Person A is more likely to be born to a single-parent household, be exposed to fewer words and to more television. She is breastfed less often, starts preschool later, and will have poor access to health care and miss important immunizations, screenings, and treatments. These effects will lead to impaired psychological, emotional, language, behavioral, cognitive, immune, and relational development. Person B is more likely to be born to at least a dual-parent household with higher education levels, with lower stress, who have the intellectual, psychological, and economic resources to engage her in healthy educational and social experiences. She is breastfed more often, will have regular access to health care, receive her immunizations and preventive screenings, and be set up for healthy entry into childhood. Person A will have a higher likelihood of living with stressed caregivers in a dangerous neighborhood and being exposed to violence and substance abuse early. She experiences poor access to healthy food, which makes her more likely to develop childhood obesity and nutritional deficiencies. Poor quality schooling will result in lower long-term reading, writing, and math scores, and she will be more likely to be bullied. Person B will live in a safer neighborhood that she can explore with friends and will have less exposure to substance abuse and violence. She will have better access to healthy food and a lower chance of becoming obese and developing a nutritional deficit. She will have access to higher quality education and a lower likelihood to be bullied. By the end of childhood, Person A will have a drop in their quality of life, but Person B will not.
Person A is bullied at school, which causes her to make fewer healthy social connections with her peers. This leads to her feeling not connected with their school community. She is not able to afford school lunch and therefore is hungry at school and not able to maintain focus in her classes. Because of financial problems, her parents fight a lot, leading to high amounts of stress at home and poor sleep quality, which negatively impacts her focus and consequently her academics. Her parents divorce and her father leaves the home. Her father was the primary income earner of the household, and her mother's income cannot successfully sustain them both. She drops out of high school to get a job so that she can contribute to the expenses because she now knows that college will not be an option for her. Problems at home and no social connections lead her to find social connections elsewhere. She becomes involved with individuals at her job who are much older than her, and she begins to abuse alcohol and drugs and become sexually active with men. Because she has never taken a sexual education course and has never learned about safe sex, she becomes pregnant. Person B's family is able to afford to give her lunch money, and she buys a healthy and high-quality meal at school and is therefore able to focus better in her classes. She is able to excel in all her classes and is able to join advanced placement courses that are helpful for college admissions. She makes friends with her classmates who are also in her courses, and because she lives in a safe neighborhood and is never exposed to violence or drugs, she is able to hang out with these friends without the influence of drugs and alcohol. Her parents are happily married, and there are no arguments regarding finances at home. She is able to graduate from high school with an honors degree and receives admission to a highly ranked university with an accompanied scholarship. Although her parents are not able to pay for her full tuition in college, she takes out student loans to help her pay for the tuition. At the end of teen years, Person A will have a drop in their quality of life, and Person B will not.
Person A's job did not give her time off from maternity leave and did not secure a position for her to return to, so she had to collect unemployment and relies on government assistance programs for food. She does not have a lot of money coming in, so sometimes she has to sell her body or skip meals so she can feed her kid. Her jobs are minimum wage and unskilled and do not provide any health insurance, so she does not seek out preventative care and relies on the emergency room when her kid gets sick. She's starting to feel wear on her body from her jobs that make her stand all day. She has very little social support. Meanwhile, Person B went to college and gets good grades and makes a lot of friends. She gets an internship that ends up hiring her after graduation. Her job is low stress and has a low physical burden. She's able to go home and enjoy leisure activities after work. She meets a man her age in the office and they eventually get married, buy a house, and have kids. They were able to seek out family planning. Her job provides paid maternity leave and job security as well as health insurance, so she is able to access regular visits with all of her doctors. At the end of their adult years, Person A's quality of life will drop, but Person B's will not.
Person A. At 37, she still can't afford to feed her family 3 meals a day. She has started smoking because it curbs her appetite and helps with stress. The only food options near her home are fast food chains. She hasn't been to the doctor since having her last child. She just can't afford it. Her son has gotten in trouble with the law lately. She has been feeling more depressed and really wishes she could speak with someone. Her lack of education has kept her in low-paying jobs in a very stressful situation. This has taken a toll on her physically and emotionally. She is beginning to develop some chronic medical conditions. Person B. At 37, she has just been offered a promotion at work. Her family regularly visits the farmer's market and uses the bike trails close by. At her annual exam, the doctor found a breast mass. Testing was done quickly, and because it was an early-stage cancer, she only needed surgery. She is so grateful for her health insurance and her therapist that was able to help her through this stressful time. Her education put her on a successful career track. The benefits helped when she had a major medical issue. She is able to afford living a healthier lifestyle and has not developed any chronic medical illnesses. At the end of adulthood, Person A will see a decline in her quality of life and Person B will not.
Person A was 65 years old when died. Her children placed her to a nursing home when she was 50 after being disabled by below-the-knee amputation due to her chronic illnesses and early cognitive decline as a result of her low educational attainment. Not having social support exacerbated her depression and anxiety, which made her chronic conditions worsened in a point where she relied on continuous oxygen CPAP machine while sleeping and dialysis to stay alive. When her heart failure was deteriorated, she was taken to the hospital where she was pronounced dead. No family member was present when she was dying and no burial arrangements were made. No next of kin, family or healthcare proxy contact information were available on her file. Hospice nurse and nursing home called to make the arrangements. Stony Brook Medicine public health students raised funds for her burial. Rest in peace. Person B is still living at the age of 95 in a summer house by the water. Makes her hairdresser and manicurist come her home when she needed. She has a private aide who helps her with errands and housework. Her children visit her often, almost every day, and has friends to play bingo, read, sing, watch movies, and do other activities. Her health has been remarkable outside of occasional pain from arthritis, which is controlled with pain medications, and some age-related functional decline. She stated and signed her living will. Her funeral and burial arrangements are made in advance. She is excited about her trip to France next month with her family.
From birth, those born into the middle class have more opportunity than those born into a lower socioeconomic status, and changing economic classes across generations is rare as a result of a cycle of poverty. One socioeconomic class is a matter of luck, not inherent skill, intelligence, or worth. We must work towards a more equitable society where everyone is provided and supported with the basic resources and environments to strengthen their biological, psychological, and social wellness.